following video was put together to demonstrate the importance of teamwork in a trauma resuscitation. Each member of the team has a specific role and assignment to perform, and it's up to the team leader to make sure everyone performs their task in a coordinated fashion. The trauma itself and the resuscitation is not a time to veer from standard protocols and policies or try new things. For patient safety, a high reliability organization utilizes crew resource management and situational awareness to make sure the patient gets the best care possible. The purpose of the short communication is to be direct. It is not intended to be anything else but performed in a way where everybody is on the same page. Each member of the team should look out and see if there's anything that another member may not be visualizing at the time of the resuscitation. And an interchange of communication amongst the members is vital.
Okay, thanks EMS. We'll see you in 5 minutes.
What's coming in?
We've got a 21-year-old male, unrestrained driver, 50 miles per hour rollover with the airbag deployed. Airway is patent. GCS of 15, blood pressure 115/78. ETA approximately 5 minutes.
Any loss of consciousness?
No.
All right, thank you. All right, what are we going to do if we need an airway?
Our plan is we're going to do video laryngoscopy with a CMEC. We have a size 4 curved blade available. We also have the D blade available. If there's any issue, we have an LMA for backup as well as bougie for assistance. Depending on what the patient's airway status looks like, either myself or the senior resident will take the first attempt. We will communicate with it to you before the patient, before we do an intubation attempt.
Inline stabilization, who's going to do it?
Do we have a tech or a junior member of the trauma team who could perform that? Excellent. Okay.
Cricoid?
Cricoid. Could I have a member of the trauma team apply that for me, please?
Cheryl at the
Excellent. Thank you.
All right.
I'm your primary nurse, Dexter. If you could get my labs for me, Aaron
Yes,
is my cut off the patient's clothes and hook them up to the monitor. You got it.
Got it.
Hi, we got a 21-year-old male who was involved in a rollover accident on the expressway. Unrestrained, airbag deployed. He's got pain on the lower left rib cage on inspiration. Backboard C-collar, we got an IV established. 18 gauge left hand tube. No past medical history, no allergies.
Ready? 1, 2, 3.
He's awake, alert.
What's your name, sir?
Any changes in route?
No changes in route.
Airway is intact. Bring your mouth, sir.
All right, let's get the press down, the rest of the primary survey.
Airway is clear. No active bleeding.
Sir, take some deep breaths for me.
Large laceration to left foot. Can you help?
Breath sounds clear bilaterally. All right, let's get him hooked up to the monitors, get a heart rate and a blood pressure.
Good femoral pulses bilaterally.
How's this Glasgow coma scale?
He's awake, he's alert, he's answering questions appropriately, eyes are open. He's a GCS 15. Tympanic membranes are clear.
Yes, arterial blood gas, please.
What level labs would you like?
Start with a panel 2, high-speed MDC.
Look right into the light, sir.
I have an 18 on the right forearm. I'm drawing blood.
Pupils are 3 to 2 millimeters bilaterally.
What panel is it?
Pulse is 68, blood pressure is 132/74.
All right, what about on exposure? What cutaneous manifestations of trauma are present?
It looks like we've got a bad bruise and some a hematoma of the left upper quadrant. We've got an open fracture of the left thigh. The femur is exposed, as well as a deep laceration, 2 deep lacerations to the right foot.
All right, let's get ready to log roll. We have IV access established. The labs have been drawn. We did get a blood gas.
Labs have been drawn.
All right, so
labeled.
I'm going to need one person. We're going to roll him towards me. I'll need one person on this side to check his spine and perform a rectal exam.
That way?
Which way are you going?
We're going to roll towards me.
switching.
Yep.
Are you doing the exam?
Are you going to examine it or?
We can roll towards you. It's fine.
Okay.
All right, so
Alright,
roll
on
the
my
patient's
channels.
left, cross your arms, and count down at the head.
Alright, on 3, 1, 2, 3.
Okay, sir.
Want to get a sheet?
Can you feel my fingers on the top of your spine? Good. I want you to answer me verbally. Do you have tenderness? How about here? 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 Any tenderness? Yes or no? Good. Any tenderness? Tenderness? No? Lube? Rectal exam? Normal sphincter tone, there's no blood.
Back down on 3, 1, 2, 3.
Roll the other way.
Are we checking the blood pressure?
Dr. Famous, what radiology studies would you like?
Start with a chest and a pelvis x-ray.
Okay, we're going to roll towards the patient's right side here.
Now let's get them rolled one more time before the film.
On 3, 1, 2, 3.
Okay, maintaining
Any other obvious
cervical
signs of injury?
stabilization. There's no other signs of injury on the patient's left side. We can put him back down.
On 3, 1, 2, 3.
His heart rate has
Doc-
gone up to 140.
His blood pressure is also low,
I'm going to perform a
Sir.
fast exam.
and his level of consciousness has
Yeah, it's not
declined, sir.
Not questions anymore.
Aaron, can you get your
All right, so what do you want to do with his altered mental status and his
We're gonna-
tachycardia?
We're gonna go ahead and intubate him since he's decompensating. Secure his airway now.
All right.
Let's go ahead and give accommodate. We'll do 20 milligrams. And we'll also do rocuronium. We'll do 100 milligrams of rocuronium.
I'll be providing
right,
pressure for intubation.
Who's gonna be
Make
applying,
sure
who's
you-
gonna be doing the C-spine stabilization?
Make sure you use 3 fingers, one on each side of the trachea.
Thank you.
Are you gonna
I can
do
do
C-spine?
C-spine, and I have the medication.
Okay.
We'll push the
I'm
medication.
gonna go ahead and
There's
pull
the
off this,
accommodate, here's the
sorry.
rocuronium.
We have a good pulse ox tracing.
How much, you said 100 of rocuronium?
Over here.
100 of rocuronium, and how much accommodate would you like, doctor?
20 of accommodate, 100 of rocuronium.
The pulse ox is attached. We have a good tracing. He's currently sat at 100%.
Take the call if he would release this.
Let me know when you're ready for the RSI.
Or you can shoot that.
What's that?
Okay. Let's get,
All right, let's
Danny, do we have the suction? Do we have the suction?
Suction is ready.
Suction's ready. Is the ET tube?
ET tube is ready.
Do we have a DVM ready? We have our end-tidal CO2 as well. We have our backup airway equipment there as well. Let's use a size 3 blade based on this gentleman's anatomy.
Make sure we have the end title on the big monitor up there.
End tidal CO2 is 35.
If you could apply either apply 100% non-rebreather mask to pre-oxygenate them, please.
I'm ready for the RSI whenever you are, doctor.
All right, equipment
Okay.
checks out okay?
Your equipment checks out okay. You have your meds ready?
Yes, I do.
Okay.
All right, I'll be holding cricoid pressure.
And I'll be holding C-spine stabilization.
All right, so we've got our, everything set.
The satellite men will be ready.
And you have a subclinic suction tube.
We do. We have it right behind me.
Yes.
All right, go ahead and push the accommodate.
Accommodate.
And push immediately after that, push the rocuronium.
Rocuronium.
Thank you.
Okay.
And it's infused.
Okay. Let's check for loss of muscle tone. Right, Danny.
Saturation is 98.
All right, Danny, I think you're ready to go. Let's go.
Rip.
Two, please. There you go.
Nice view of the cords.
Wonderful.
All right, don't let go of end tidal CO, or of the cricoid pressure till we get.
Balloon is past the cord.
end tidal
Stylet is out.
CO2.
Balloon is up.
6 breaths and check the end tidal.
End tidal CO2 is 34.
So check breath sounds, please.
All right.
Good breath sounds on the right. Good, breath sounds to the left. No breath sounds over the stomach.
Great. I'm going to perform a fast exam.
Let's get a chest x-ray. The collar's on.
Put the
We're
collar.
gonna put the collar back on.
All right, good.
I'm rechecking the vitals.
Chest x-ray. We're gonna need an OG tube as well.
Blood pressure is still 110 over 80, but the pulse has gone up to 110.
Vitals are repeating. IV fluid still infusing.
That was the last blood pressure, so get me a new blood pressure.
All right, quick chest x-ray.
All right, everybody with lead. Lead.
Go left.
Lead.
X-ray back up, good. All right, it's good.
All right.
Alright.
Send those over as soon as you get them.
All right.
We have a few skeletal films we'll need before you leave.
Blood pressure 103.69. Heart rate still 128.
He has positive fluid in the left upper quadrant.
All right, how about in the pelvis?
Sounds good.
The
Yeah.
ET tube is seen above the carotid, below the clavicles. Is there any further assistance with the ET attending needed?
Not right now. Thank you very
Thank
much.
you.
Appreciate it. Let's recycle the blood pressure.
He has fluid in the pelvis.
I'm not happy with his tachycardia.
We're checking the blood pressure.
Run the fluid in wide open. Run that
Running wide
leader.
open.
He has
Let me
fluid
know.
in Morrison's pouch.
So he's got diffuse hemoperitoneuria. Let me know what his repeat blood pressure is.
And
60 over 40. All right, start that massive transfusion protocol. Call the operating room.
okay,
We'll let him
you wanna
know.
go down and pick up the
We
blood.
have a case. Bring him straight up to the OR. We'll have to image his extremities. Give him the left femur. Check for pulses in his left foot. We have a hair traction we can apply either up in the OR after we address his hemoperitoneuria. Secure the tube, package them up, and let's get them up to the OR ASAP.
OR will be ready in 10 minutes. The massive transfusion protocol has been initiated. Mike is on his way down to the blood bank to grab the blood.
All right, so we're going to hang a couple units on the before we take them up. Tell the OR we need it sooner than 10 minutes, all right? We're going to be coming up in 5.
Okay.
Also, give them some antibiotics, a
Okay.
couple grams of cefazolin.
Got it. Couple of grams of cefazolin, couple of units before the OR. If it's like this.
All right, the OG tube,
Is there-
utilization. All right.
Confirmed by auscultation.
All right. Anything else? Any from the team? All
We'll get the level 1 starting, level 1 transfusion.
right. Anything else? Blood gas pack.
I'll get the monitor for the OR.
All right. Base deficit of 7. All right. Okay, we need to get him up to the OR. Address his hemorrhage. I'll meet you up in the OR.
All right.
All right. Thank you.
All right, it's been 5 minutes. Everyone ready?
Yep.
All right, let's go to the OR. Got the blood too?